The fluorescent lights of Seattle Grace Hospital's emergency room flickered slightly as Marcus Thompson burst through the automatic doors, his 7-year-old daughter Lily cradled in his arms. Rain dripped from his construction worker's jacket onto the polished floor, leaving a trail of water behind him. His heart pounded against his ribcage so hard he thought it might explode. "Please, someone help! My daughter, she can't breathe properly!" His voice cracked with desperation, cutting through the usual chaos of the ER. Lily's small face was pale, almost translucent under the harsh lighting. Her lips had taken on a faint bluish tint that made Marcus's stomach drop every time he looked at her. She clutched her chest with one tiny hand, while the other gripped his shirt so tightly her knuckles were white. "Daddy, it hurts," she whispered, her voice barely audible over the ambient noise of medical equipment and urgent conversations. Each word seemed to cost her enormous effort. A nurse rushed over immediately, her experienced eyes quickly assessing the situation. "How long has she been like this?" she asked, already guiding them toward a triage bay. "About 30 minutes. She was fine at dinner, then suddenly she couldn't catch her breath. She has asthma, but her inhaler didn't help this time." Marcus's words tumbled out rapidly as he followed the nurse, refusing to let go of his daughter. "Please, you have to help her. She's all I have." The nurse's expression remained professionally calm, but Marcus could see the urgency in her movements as she called for assistance. Within seconds, they were surrounded by medical staff. Someone placed an oxygen mask over Lily's face, while another checked her vital signs. "Heart rate elevated, oxygen saturation at 82%, a young resident announced, his voice steady despite the emergency. "We need to get her stabilized now." Marcus felt his world tilting. 82%. He didn't need medical training to know that wasn't good. His hands trembled as a nurse gently but firmly guided him back to give the medical team room to work. "Sir, I need you to step back so we can help her," the nurse said kindly, her hand on his shoulder. "I can't leave her. She's scared. She needs me." Marcus's voice broke, and he hated how helpless he sounded. For 5 years, since his wife Sarah died in a car accident, he'd been both mother and father to Lily. He'd handled scraped knees, nightmares, first days of school, and every childhood illness that came their way. But this was different. This was beyond band-aids and comfort. "You're not leaving her. We just need space to work." "You can stay right here where she can see you," the nurse reassured him, positioning him at a spot where he had a clear view of his daughter, but wasn't in the way. Lily's frightened eyes found his through the crowd of medical professionals. Even with the oxygen mask covering half her face, he could see her terror. He forced himself to smile, to be strong for her the way he always had been. "I'm right here, baby girl. These doctors are going to make you feel better, okay? Daddy's not going anywhere." A doctor Marcus didn't recognize was now at Lily's side, listening to her chest with a stethoscope. The doctor's brow furrowed in concentration, and Marcus felt his anxiety spike even higher. "Decreased breath sounds on the right side, possible pneumothorax," the doctor said to the team. "Get me a chest x-ray stat and page Dr. Chen. If this is what I think it is, we might need surgery." Surgery. The word hit Marcus like a physical blow. His little girl, who still slept with her stuffed rabbit and believed in the tooth fairy, might need surgery. He watched helplessly as they wheeled a portable x-ray machine toward her bed. "Sir, I need you to step outside the curtain for just a moment during the x-ray," a technician said apologetically. Marcus nodded numbly, taking a few steps back, but keeping his eyes locked on Lily through the gap in the curtain. He could still see her small hand reaching out toward where he'd been standing. The sight nearly broke him. The ER around him was a blur of activity. Other patients with their own emergencies, families with their own fears, medical staff moving with practiced efficiency through chaos. But for Marcus, the only thing that existed was that examination bay where his daughter fought for each breath. His phone buzzed in his pocket. He pulled it out with shaking hands to see a text from his supervisor at the construction site. "Everything okay? You left in such a hurry." Marcus stared at the message, unable to formulate a response. How could he explain that his entire world was currently lying on a hospital bed, struggling to breathe? He shoved the phone back in his pocket without answering. Mr. Thompson, the doctor who'd examined Lily, emerged from behind the curtain, X-ray images on a tablet in hand. "I'm Dr. Rodriguez. I need to talk to you about your daughter's condition." Marcus's throat went dry. The doctor's expression was serious but not panicked, which he took as a marginally good sign. "Lily has what we call a spontaneous pneumothorax, a collapsed lung. It's more common in tall, thin adolescents, but it can happen in children too. Part of her lung has deflated, which is why she's having so much trouble breathing." "A collapsed lung?" Marcus repeated, trying to process the information. "But how? She was just playing with her toys before dinner. She was fine." Sometimes these things happen without any apparent cause or injury. The good news is that it's treatable. We need to insert a chest tube to re-expand the lung, and depending on how she responds, she may need a surgical procedure to prevent it from happening again. "Surgery," Marcus whispered, his worst fear confirmed. "Let's see how she does with the chest tube first." "But Mr. Thompson, I want to be honest with you. Given her age and the severity of the collapse, we've called in our chief of thoracic surgery, Dr. Chen, to evaluate her. She's one of the best in the country. Your daughter will be in excellent hands." Marcus nodded, not trusting himself to speak. The doctor placed a reassuring hand on his shoulder before heading back to Lily. He was allowed back to her side a moment later. Lily's eyes were heavy now, whether from lack of oxygen or exhaustion he couldn't tell. He took her small hand in his, careful not to disturb the IV line they'd placed. "Daddy's here, Lily Bear. You're being so brave, so brave." His voice was thick with emotion. "Tired, Daddy," she murmured through the oxygen mask. "I know, sweetheart, but you have to stay awake for me a little longer, okay? The doctors need you to stay awake." The minutes crawled by with agonizing slowness. Marcus watched the monitors, not fully understanding all the numbers, but knowing that the oxygen saturation number needed to go up. It hovered stubbornly around 85% despite the oxygen mask. "We need to prep her for the chest tube," Dr. Rodriguez said, returning with more supplies. "Mr. Thompson, this is going to be uncomfortable for her, but it's necessary." Marcus squeezed Lily's hand gently. "I'll be right here the whole time, baby. Squeeze my hand if you need to, okay?" What followed were some of the longest minutes of Marcus's life. Even with local anesthesia, Lily whimpered in pain as they inserted the chest tube between her ribs. Marcus blinked back tears, maintaining his brave face while his heart shattered with every sound of distress his daughter made. "You're doing so good, Lily. So good. Almost done, sweetheart." Finally, it was over. The chest tube was secured, connected to a drainage system, and Marcus could see immediate improvement. Lily's breathing became less labored, though she was clearly exhausted and in pain. "Oxygen saturation coming up. 90%, 92%, the nurse announced with visible relief. Marcus let out a breath he didn't know he'd been holding. 92%. Better. Not great, but better. "The chief surgeon is on her way," Dr. Rodriguez informed him. "She'll want to examine Lily and review the X-rays to determine if surgery is necessary. In the meantime, we're going to move her to a pediatric room where she'll be more comfortable." As they prepared to transfer Lily to a gurney, Marcus finally allowed himself a moment to text his supervisor. "Family emergency. My daughter is in the hospital. Will update when I can." The response came immediately. "Take all the time you need. We've got you covered. Praying for your little girl." Marcus pocketed his phone, grateful for understanding, but knowing that missing work meant missing pay he desperately needed. As a single father, every dollar counted toward rent, food, Lily's school expenses. But none of that mattered right now. Nothing mattered except his daughter getting better. They were settled into a private pediatric room, decorated with cheerful murals of cartoon animals, when a nurse stuck her head in. "Dr. Chen will be here in just a few minutes. She's finishing up another case." Marcus nodded, positioning his chair as close to Lily's bed as possible, without being in the way. His daughter's eyes were closed now, her breathing steadier, but still monitored by a constellation of machines that beeped and hummed. The chest tube container on the floor showed a small amount of drainage, evidence that the procedure was working. He thought about all the times over the past 5 years when he'd felt inadequate as a parent. The school plays where he was the only dad in a sea of mums. The times he'd braided Lily's hair all wrong and she'd politely asked him to try again. The parent-teacher conferences where he'd felt judged for being a single father. But through it all, he'd never felt as powerless as he did right now, watching his daughter suffer and unable to do anything to fix it. The sound of footsteps in the hallway pulled him from his thoughts. A woman's voice, confident and clear, was giving instructions to someone about another patient. Marcus straightened in his chair, preparing to meet the surgeon who would decide his daughter's fate. Then Dr. Elizabeth Chen walked through the door, and Marcus's entire world stopped. The tablet in Dr. Chen's hand nearly slipped from her grasp as her eyes met Marcus's across the hospital room. For a moment that seemed to stretch into eternity, neither of them moved. The confident, composed chief of thoracic surgery, who commanded operating rooms with steady hands and unwavering focus, found herself completely frozen. "Marcus?" Her voice came out barely above a whisper, so unlike her usual authoritative tone. "Elizabeth." He stood up slowly, his expression unreadable. The use of her first name hung in the air between them, like a ghost from another lifetime. The nurse in the room glanced between them, sensing the sudden tension but unclear about its source. Dr. Chen recovered her composure with visible effort, her professional mask sliding back into place, though her hands trembled slightly as she gripped the tablet. I didn't know," she started, then stopped, realizing how inappropriate this conversation was in front of staff and, more importantly, in front of the patient. "Nurse Williams, could you give us a moment, please?" The nurse nodded and quietly exited, closing the door behind her with a soft click that seemed deafening in the sudden silence. Elizabeth's eyes moved to the small figure in the bed, and something in her expression cracked. "This is your daughter?" "Yes, Lily. She's 7. Marcus's voice was carefully controlled, but she could hear the strain beneath it. "Can you help her, or do we need someone else?" The question was fair, even expected, but it still stung. "Marcus, I'm the best thoracic surgeon in this hospital. Whatever is between us, whatever was between us, I would never let that affect my patient care. Never." "I know," he said quietly, surprising her. "I remember how dedicated you were to medicine, how it came before everything else." There it was, the wound that had never fully healed for either of them. Elizabeth closed her eyes briefly, then moved to Lily's bedside with professional focus, though her heart was racing. "Tell me what happened," she said, pulling up the digital chart on her tablet while visually assessing the young patient. Marcus recounted the evening's events, his voice steady despite the emotion evident in his eyes. Elizabeth listened while examining Lily, who was sleeping now, her small chest rising and falling with more regularity thanks to the chest tube. "The spontaneous pneumothorax is significant," Elizabeth said, studying the X-rays with her practiced eye. "At her age, this is unusual, but not unheard of. The concern is recurrence. If we don't address the underlying issue, it could happen again, possibly when she's somewhere help isn't readily available." Dr. Rodriguez mentioned surgery might be needed. Video-assisted thoracoscopic surgery, VATS. "We would make small incisions, use a camera to identify any blebs or weak spots in the lung tissue, and repair them. It's minimally invasive compared to open surgery, and the recovery time is much faster." She paused, meeting his eyes. "I've performed this procedure hundreds of times, Marcus. My success rate is among the highest in the Pacific Northwest." When would you want to do it? I need to see how she responds over the next few hours. If the lung re-expands well and stays expanded, we might be able to take a more conservative approach. But if there are any signs of continued air leakage, or if I see any concerning abnormalities on the imaging, I'd recommend we operate within the next 24 to 48 hours. Marcus ran a hand through his hair, a gesture Elizabeth remembered from years ago when he was stressed. Some things, apparently, never changed. I need to ask you something, he said, his voice lower now. And I need you to be honest with me. Are you going to be able to do this? Because if there's any hesitation, any conflict, I need to know now. She's all I have, Elizabeth. She's my entire world. The raw vulnerability in his voice cut through Elizabeth's professional detachment. She set down the tablet and took a step closer, though still maintaining an appropriate distance. I understand your concern, and you have every right to request another surgeon if you're not comfortable with me. But I promise you, Marcus, when I'm in that operating room, nothing exists except my patient and the procedure. Not our past, not my feelings, nothing. Your daughter will get the absolute best care I can provide. Our past, Marcus repeated softly, a bitter smile touching his lips. That's one way to put it. Elizabeth felt the familiar ache of old regrets rising in her chest. Marcus, Don't, he interrupted, holding up a hand. Not here, not now. Right now, I just need to know my daughter is going to be okay. She nodded, grateful for the boundary, even as part of her wanted to explain, to apologize, to try to make him understand decisions she'd made 9 years ago. But he was right. This wasn't the time or place. Let me check her lung sounds, Elizabeth said, pulling out her stethoscope. She listened carefully to Lily's breathing, noting the improved air movement on the affected side. Better. The chest tube is doing its job. I'm going to order another X-ray in a few hours to see how much the lung has re-expanded. As she worked, making notes in the chart and adjusting some of Lily's medications, Marcus watched her with an expression she couldn't quite read. The years had changed them both. The ambitious medical resident he'd known had become this confident surgeon with silver threading through her dark hair and fine lines around her eyes. But some things were the same. The gentle way she touched her patient, the focus in her eyes when she worked, the small furrow between her brows when she concentrated. She looks like her mother, Elizabeth observed quietly, glancing at Marcus. I can see it in her features. Sarah died 5 years ago. Car accident. The words were matter-of-fact, but the pain beneath them was evident. Elizabeth's hand stilled on the tablet. Oh, Marcus, I'm so sorry. I didn't know. How would you? There was no accusation in his tone, just statement of fact. They hadn't spoken since the day she'd chosen her surgical residency in Boston over their relationship, over the life they'd been planning together in Seattle. That had been 9 years ago, a lifetime in some ways. You raised Lily alone? Elizabeth asked softly. Yeah, it's been just the two of us. Some days are harder than others, but she's the best thing that ever happened to me. He looked at his sleeping daughter with such love that Elizabeth felt her heart constrict. I'd do anything for her. Anything. I can see that. Elizabeth finished her notations and prepared to leave, though part of her wanted to stay, to ask him about his life, to explain her own choices, but this wasn't about them. I'll be back in a few hours to check on her. The nurses will monitor her closely. If anything changes or if you have any concerns, tell them to page me immediately, day or night. Thank you, Marcus said, and despite everything, she could hear that he meant it. Elizabeth paused at the door, looking back at them. This man she'd once loved, and the daughter who needed her skills now. Marcus, I know this is complicated, but I want you to know, I'm going to take care of her. I promise you that. He nodded, and for just a moment she saw something in his eyes that looked like trust, or maybe just hope. Either way, it was more than she deserved. After she left, Marcus sank back into his chair, emotionally exhausted. Of all the surgeons in Seattle, it had to be Elizabeth, The woman he'd planned to marry, who'd chosen her career over their future together. He'd been devastated when she left for that prestigious program in Boston, especially since he'd just proposed, and she'd said yes, only to change her mind 2 weeks later. He'd thought he was over it, had moved on with his life, married Sarah, had Lily. But seeing Elizabeth again brought back a flood of memories and emotions he'd thought were long buried. Lily stirred in her sleep, making a small sound of discomfort. Marcus was immediately at her side, gently stroking her hair. "Shh, baby girl. Daddy's here. Everything's going to be okay." But as he said the words, he wondered if he was trying to convince Lily or himself, because nothing about this situation felt okay. His daughter was seriously ill, and the surgeon who might need to operate on her was the woman who'd broken his heart years ago. The night wore on slowly. Nurses came and went, checking vital signs, adjusting medications, offering Marcus coffee that he barely touched. He couldn't eat, couldn't think about anything except his daughter and the uncertain hours ahead. Around midnight, Elizabeth returned to check on Lily and review the latest X-rays. She knocked softly before entering, her eyes meeting Marcus's in the dim light of the room. "The lung is responding well," she said quietly, not wanting to wake Lily. "Another 24 hours, and we'll have a better picture of whether surgery is necessary." "That's good, right?" Marcus's voice was hoarse from lack of sleep and stress. "It's cautiously optimistic," Elizabeth replied, studying the images on her tablet. "But I want to be honest with you. Even if the lung re-expands fully, given her age and the spontaneous nature of this event, I'd still recommend the procedure. The risk of recurrence without surgical intervention is significant." Marcus nodded slowly, processing the information. How long would she be in the hospital after surgery? Typically 3 to 5 days, depending on her recovery, then restricted activity for a few weeks. Elizabeth glanced at him, noticing the exhaustion in his face. "Marcus, when was the last time you ate something?" "I don't know. Lunch, maybe. There's a cafeteria on the 2nd floor. It's open 24 hours. You should get something to eat." "I'm not leaving her." "And I'll stay with her," Elizabeth offered, the words surprising them both. "Just for 20 minutes. You need to maintain your strength for Lily's sake." Marcus wanted to refuse, but the concern in Elizabeth's eyes was genuine, and he realized he was being stubborn. 20 minutes, he agreed reluctantly. "If anything changes, I'll call you immediately. Go." He hesitated at the door, looking back at his daughter and the woman sitting vigil beside her. It was a surreal image, his past and his present colliding in the most unexpected way. Then he forced himself to leave, trusting Elizabeth with the most precious thing in his life, even though she'd once proven herself untrustworthy with his heart. Alone with Lily, Elizabeth allowed herself to really look at the child, Marcus's daughter. In another life, in another world where she'd made different choices, she might have had children of her own by now, maybe even with Marcus. But she'd chosen surgery, chosen the career that had defined her for so long. It had been the right choice, or so she'd told herself for years. Now, sitting in this quiet hospital room, she wasn't so sure. The next morning arrived with pale Seattle sunlight filtering through the hospital room window. Lily woke slowly, confused by her surroundings and the uncomfortable tube in her side. Her immediate cry for her father brought Marcus rushing from the chair where he'd been dozing. "I'm here, baby." "Daddy's right here." He took her hand carefully, mindful of the IV line. "It hurts, Daddy," Lily whimpered, tears streaming down her small face. "My side really hurts." A nurse appeared almost instantly, alerted by the monitors. "Let me get her some pain medication," she said kindly, checking Lily's vitals. "You're being very brave, sweetie." Within minutes the medication began to work, and Lily's tears subsided. She looked around the room with frightened eyes, taking in the monitors, the tubes, the unfamiliar surroundings. "Am I very sick, Daddy?" Marcus swallowed hard. He'd always been honest with Lily, believing she deserved truth, even when it was scary. "Your lung had a problem, but the doctors are fixing it. You're going to be okay." I heard you talking to the doctor last night. The lady doctor. Lily's voice was small but curious. You called her Elizabeth. Do you know her? Marcus hadn't realized his daughter was awake during that conversation. He should have known better. Lily was perceptive, always had been. I knew her a long time ago before you were born, before I met your mommy. Was she your friend? Yes, Marcus said after a pause. She was my friend. Before Lily could ask more questions, Elizabeth entered the room with another doctor, a kind-looking man in his 50s. Good morning, she said professionally, though her eyes softened when she saw Lily was awake. This is Dr. Patterson, our pediatric specialist. We're going to examine you, if that's okay. Lily nodded shyly, instinctively moving closer to her father. Marcus stood beside the bed, providing the security of his presence while the doctors worked. Elizabeth was gentle and patient, explaining everything she was doing in terms a 7-year-old could understand. I'm going to listen to your lungs with this stethoscope. It might feel a little cold, but it won't hurt. Can you take a deep breath for me? As Lily complied, Marcus watched Elizabeth work. He noticed the way she spoke to his daughter with respect, not condescension. The way her hands were gentle but confident. Despite his complicated feelings about her, he couldn't deny she was an excellent doctor. After the examination, Elizabeth pulled up the latest X-rays on a tablet and showed them to Marcus. The lung has re-expanded about 60%, which is good progress. But she hesitated, glancing at Lily before continuing. Could we talk outside for a moment? Marcus kissed Lily's forehead. I'll be right outside the door, okay? You can see me through the window. In the hallway, Elizabeth's expression grew more serious. The lung is improving, but I can see what looks like blebs on the imaging, small air-filled sacs that are likely what caused the spontaneous collapse. Marcus, I strongly recommend we proceed with the surgery. Without it, there's a 70 to 80% chance this will happen again, and with the surgery, the recurrence rate drops to less than 5%. She met his eyes directly. I know you have concerns about me being her surgeon. I've arranged for Dr. Patterson to be present during the entire procedure. You're also welcome to seek a second opinion from another thoracic surgeon. I can recommend several excellent colleagues. Marcus was quiet for a long moment, weighing his options. Finally, he said, Lily asked me this morning if I knew you. I told her we were friends once. Were we? Elizabeth asked softly. Friends? We were more than friends, and you know it. The words carried years of hurt. We were planning a life together, Elizabeth. I had the ring. You said yes. Then 2 weeks later you told me you were moving to Boston for that fellowship, and we were over. I know, she whispered, her professional composure cracking. Marcus, I was 26 years old and terrified. Terrified of choosing wrong, of giving up my dreams, of not being enough, as a surgeon or as a partner. I thought I had to choose. You did choose. You chose surgery. I did, and I've lived with that choice every day since. Elizabeth's eyes glistened with unshed tears. I'm not asking for forgiveness or for you to understand, but I need you to know that letting you go was the hardest thing I've ever done, and not a day has gone by that I haven't wondered if I made the right decision. Marcus stared at her, seeing the vulnerability she rarely showed. Did you make the right decision? I became an excellent surgeon. I've saved hundreds of lives. I'm at the top of my field. She paused, a bitter smile touching her lips. But I'm also 41 years old, alone, and looking at what might have been. So you tell me, Marcus, was it worth it? The honesty in her words caught him off guard. He'd spent years imagining her living her best life, not regretting her choice, certainly not thinking about him. Why did you come back to Seattle? My father got sick 2 years ago. Alzheimer's. I came back to be closer to him, to help my mother. He passed 6 months ago. Her voice wavered slightly. Being back here, walking these same streets where we used to walk, going to places we went together, it's been harder than I expected. I'm sorry about your father, Marcus said sincerely. Despite everything, he'd liked Elizabeth's father. Thank you. She straightened, pulling herself together. But this isn't about us. This is about your daughter. So I need to know, do you trust me to operate on Lily? Because if you don't, I completely understand. Marcus looked through the window at his daughter, who was watching them anxiously. Then he looked back at Elizabeth, really looked at her. He saw the skilled surgeon who dedicated her life to her craft. He also saw the woman who'd broken his heart, but who was clearly still broken herself. And he saw something else, genuine care for his child. When would you want to do the surgery? Tomorrow morning. She's stable enough now, and I don't want to wait too long. The longer we wait, the higher the risk of another collapse. He took a deep breath. Okay, do it. You do the surgery. Relief flooded Elizabeth's features. Thank you. I promise you, Marcus, I will take care of her like she's my own. I know you will, he said, and meant it. You might have walked away from us, but you'd never walk away from a patient who needs you. The words were both a compliment and a critique, and they both knew it. They returned to Lily's room, where Elizabeth explained the surgery in terms the 7-year-old could understand. We're going to fix your lung so it doesn't collapse again. You'll be asleep the whole time, and when you wake up, your daddy will be right there. Will it hurt? Lily asked fearfully. Your side will be sore afterward, but we'll give you medicine to help with the pain. And you know what? After you're all healed, you'll be able to run and play just like before, maybe even better. Really? A small spark of hope appeared in Lily's eyes. Really, I promise. Elizabeth smiled at her, and Marcus saw genuine warmth in that smile. You're very brave, Lily, and your daddy is going to be with you every step of the way. The rest of the day passed in preparation for the surgery. Marcus filled out paperwork, signed consent forms, and tried to keep Lily's spirits up. Elizabeth checked on them 3 more times throughout the day, always professional, but with an underlying gentleness that reminded Marcus of the woman he'd once known. That evening, after Lily had fallen asleep, Elizabeth returned one final time. She found Marcus standing at the window, staring out at the Seattle skyline with his hands in his pockets. "Can't sleep?" she asked quietly. "Can't stop thinking about tomorrow. What if something goes wrong? What if—" "Marcus," she interrupted gently, "I've performed this surgery more than 300 times. I know every possible complication and how to handle it. I know that doesn't eliminate the fear, but I need you to trust me." "I do trust you," he admitted. "At least I trust the surgeon. The person? That's more complicated." Elizabeth moved to stand beside him at the window, maintaining a respectful distance. "I owe you an explanation. A real one, not just what I said in the hallway." "You don't owe me anything, Elizabeth." "Maybe not, but I want to tell you anyway." She took a breath. "When I was in medical school, my attending told me I had the hands and mind to be one of the best thoracic surgeons he'd ever seen. But he also said I'd have to sacrifice everything else to get there, that the women who tried to have it all ended up being mediocre at everything. I took that to heart, probably too much." "That's ridiculous," Marcus said sharply. "Plenty of surgeons have families." "I know that now. But at 26, fresh out of residency, being offered the opportunity of a lifetime, I believed it, and I was terrified that if I chose you, chose us, I'd always wonder what I gave up, that I'd resent you eventually. So instead, you gave me up and resented yourself." The observation was so accurate that Elizabeth actually laughed, though it was a sad sound. "I've had 9 years to become an excellent surgeon, Marcus. I save lives, I teach residents, I publish research, but I go home to an empty apartment every night. I don't have someone to share my victories with or to comfort me when I lose a patient. I don't have a child who looks at me the way Lily looks at you." "You chose your path," Marcus said, but his voice was gentler now. "I did, and I'm not asking you to forgive me or to understand. I just wanted you to know that I didn't walk away from you because you weren't enough. I walked away because I was afraid I wouldn't be enough for you." Marcus turned to look at her fully. In the dim light from the hallway, he could see the vulnerability in her face, so different from her usual confident surgeon persona. "You broke my heart, Elizabeth." "I know. I broke my own too." They stood in silence for a moment, years of hurt and regret hanging between them. Finally, Marcus spoke. "After Sarah died, there were so many days I didn't think I could go on. But Lily needed me, so I did. I learned that love isn't about grand gestures or perfect choices. It's about showing up every day, even when it's hard, especially when it's hard." "You're a good father," Elizabeth said softly. "Sarah would be proud of the man you are." "I hope so." He looked back at his sleeping daughter. "Tomorrow, when you operate on Lily, I need you to know something. You might have given up on us, but I never stopped believing in you. Not as a surgeon, anyway. So I'm trusting you with the most important person in my world. Don't let her down." "I won't," Elizabeth promised. "I swear to you, Marcus, I won't." She left shortly after, needing to prep for the morning surgery. Marcus returned to his vigil by Lily's bedside, holding her small hand in his and praying to a God he wasn't sure he believed in anymore. His daughter was going into surgery tomorrow, and his ex-fiancée was the one who would cut into her chest. If someone had told him a week ago this would be his reality, he would have laughed at the absurdity. But life, he'd learned, was often absurd. The trick was surviving it. The pre-dawn hours in the hospital had a strange quality to them. Quiet, but not quite peaceful. The calm before the orchestrated chaos of surgery. Marcus hadn't slept more than an hour, watching Lily's chest rise and fall, memorizing the details of her face as if he might forget them. At 5:30 in the morning, the pre-op team arrived. Lily woke confused and frightened when they began preparing her for transport to the surgical suite. "Daddy, I'm scared," she whimpered, clutching his hand. "I know, baby girl, but remember what Dr. Elizabeth said? You're going to sleep, and when you wake up, you're going to feel so much better, and I'll be right there when you open your eyes. Promise?" "Promise." And Marcus kissed her forehead, breathing in the scent of her strawberry shampoo mixed with antiseptic hospital smell. "You're the bravest person I know, Lily Thompson. Braver than any superhero."